Good afternoon, everyone. Hope everyone enjoyed the holiday weekend and you were able to safely spend some quality time with family and friends. We have several topics to cover today, and I know it's a holiday week for many, so I'll be relatively brief. There was no White House call today, but yesterday I joined other governors on a video call with President Biden to discuss the state of the pandemic. The President reiterated some of the points he made in his address last week, and that he's committed to working with states to ensure we go forward with schools and businesses open. Even with Omicron, we have the tools we need, so we don't have the mandates of 2020. We have vaccines, testing, and sense precautions we've talked about repeatedly. Masks indoors in crowded public spaces and staying home when sick. On testing, he discussed a billion at-home tests for Americans, which we appreciate, and we look forward to learning more about their distribution plan very soon. We know rapid tests are in high demand across the country and how useful and important they are. And we handed out tens of thousands of them last week and will continue to do so this week. Before Christmas, I know there were some who were in line and weren't able to get them before they ran out. And I understand but we're doing the best we can with what we have until the federal supply chain starts flowing. We received a shipment of these tests recently, and while a majority are meant for schools and long-term care facilities, we're getting any excess rapid tests out the door as fast as we can. We hope that supply will increase, and with it, greater accessibility. Again, we've been working with federal partners for weeks on an initiative to directly distribute tests to households and hope to give you final details soon. In the next day or so, we'll also announce a strategy to get rapid tests to parents before kids return to school following winter break. You can expect this to include pickup locations for parents to get at-home tests for their kids before returning to class. Again, we're working as we speak on a plan because we just got a supply that makes this possible, and we'll have more for you in the next day or so. But the goal will be to have over 80,000 test kits, that's 2 per kit, available to parents over the next week. Mr. Pichek, today is Secretary Smith's final week as Secretary of Human Services. He promised me his farewell address wouldn't be as long as my State of the State next week. That remains to be seen. In all seriousness, once again, I just wanted to express my sincere gratitude to Mike for his hard work, dedication, and service over the course of his career. For his time as a Navy SEAL, to being one of the state's top executives. I'm not sure Vermont would be in the place it is today, the highest vaccination rate in the U.S., highest testing rate, lowest death rate, and more, if not for him being part of our talented team. Mike will be greatly missed, but we wish him all the best in his retirement, however long this one lasts. With that, Mr. Pichek.
We are seeing increases far surpassing that of the national average. New York City, for example, cases are up about 250% over the last 7 days. Washington, D.C., cases are up 450%. So cases, again, are continuing to rise in parts of the country and generally across the entire country, fueled by the Omicron variant. But nationally, and the same holds true for most jurisdictions across the U.S., hospitalizations have not seen a corresponding increase nationally 7 days. Now, of course, there is always a lag between hospitalizations and cases, but again, for the moment, across the country, this data is similar to some international jurisdictions where infections rose really significantly, but hospitalizations significantly as the cases with the Omicron variant. So we'll watch this very closely. It's a very similar story closer to home in New England. On the next slide, you'll see that cases have increased across the New England states this week by 34%, but at the same time, hospitalizations are relatively stable, increasing just 2%. Here in Vermont, our cases again have been relatively stable over the last 7 days, up about 4%. You'll see that is the case even though testing has been down about 18%. That's driven our positivity rate up this week. We're up over the 25 increase over the last 7 days. This is a similar increase after Thanksgiving, where more likely than not, more symptomatic individuals were getting tested on Christmas and over the Christmas holidays. So it appears like at the moment that Vermont is seeing a case surge fueled by Omicron, which is certainly a good sign. However, we also know that it's a matter of time until a more significant spread happens here. So the good news is we have time for those that have not gotten their booster shot to get their booster shot before we see the significant impacts of the variant. Those that are not vaccinated to get vaccinated. We'll have data again in the presentation that makes it very clear that those that are boosted and those that are vaccinated will have a very different experience with the virus if they catch it than those who are not fully vaccinated and boosted. Just again, before we turn to the hospitalization numbers, looking at the long-term care facilities, very stable for our most vulnerable Vermonters, 4 active outbreaks with 38 cases in total. Now flipping over to hospitalizations here in Vermont, we saw that our cases are up about 4%, but overall hospitalizations continue to be decreasing, down 3% over the last 7 days. And again, as we've seen for much of the Delta wave, the vast majority of individuals hospitalized are among the unvaccinated, 72% over the last 7 days. A similar story on the ICU side, where we have a 15% decrease in our ICU usage for COVID-19 patients over the last week. And again, 85% of those requiring critical care over the last 7 days are unvaccinated. So the unvaccinated continue to make up the vast majority of patients in the hospital. And as we look on the next slide, we'll see that capacity continues to be much better recently than it has been over the last several weeks, both on hospital beds overall and on the ICU beds as well. So 84 hospital beds, medical surge beds available today, 21 ICU beds available today. And again, that availability has been increasing over the last 10 days to 2 weeks or so. But again, just quickly looking at the difference between those in our hospitals who are vaccinated versus those who are boosted versus those who are not fully vaccinated. And the numbers continue to be very stark. Those who are not fully vaccinated continue to be about 23 times more likely to be hospitalized from COVID-19 over the last 6 weeks when compared to those who are fully vaccinated and boosted. And you can see that those who are fully vaccinated get a great deal of protection, but how important is in terms of giving full protection to those who contract the virus. So certainly, again, we have time, as the Omicron variant is obviously here in Vermont, but not yet impacting us in the same way as other states and other jurisdictions yet, for those that are not yet boosted to do so and get the full protection of the vaccine. Similarly, on the fatality slide, you'll see that Vermont is up to 47 fatalities for the month of December. And similar to hospitalizations on the next slide, you'll see that there's a significant difference between those who are not fully vaccinated. Again, 23 times more likely to die from the virus if they contract it over the last 6 weeks compared to those who are fully vaccinated and boosted. So those that are not yet boosted, the best chance to stay out of the hospital, best chance to not have the most severe outcomes of the virus is to get protection. And as we look at the next slide, you'll see Vermonters are doing that. They are getting their booster shots, 53% over the age of 18, 64% over the age of 50, 74% over the age of 65, Vermont remaining a leader or near the leader in all of those categories. So critical that that's happening. We had about 14,000 new Vermonters get boosted in the past week, even with the holiday weekend. So continue to make good progress on this, but need to continue to push to get those who have not yet gotten that booster shot to get it as quickly as possible. And we can see on the 5 to 11 population, continuing to make progress here. Vermont remains the national leader in those 5 to 11 with a single dose and fully vaccinated in that age group. And all of that builds up to sort of where we're heading here in Vermont and in New England. And you'll see on the last slide that cases are expected to increase over the next 4 weeks as we come out of the holiday season and as Omicron continues to spread in Vermont as well. However, as noted with the other nations around us and in the United States and internationally, the big question is what will that mean for the most severe outcomes for hospitalizations and deaths. That's still largely a big unknown at the moment, but again, the data is emerging from some of the other jurisdictions, West, and which we'll continue to watch closely over the next few weeks to see how their large increases in cases affects their hospitalizations and other important metrics. So again, we do expect cases to remain elevated and to increase following the holidays with the Omicron variant, but the impact that that will have on hospitalizations and other metrics is just not known at the moment, and that's something we'll keep a close eye on in the days and weeks ahead. So Governor, with that, I'll turn it now back over to you.
Now hear from Secretary French.
Thank you, Governor. Good afternoon. We're making plans for operating schools after the holiday break relative to Omicron. One of our top priorities remains keeping our schools open to ensure that the education of our students is not interrupted. We've used 3 strategies to keep our schools open during the pandemic. And those are the same strategies we'll use for Omicron. Those strategies are vaccination, contact tracing and testing, and mitigation recommendations for school operations. In terms of student vaccination levels, as Commissioner Pichek just highlighted, Vermont continues to make good progress in 5 to 11 in particular. As of last week, 40% of all 5 through 11-year-olds have completed both shots of Pfizer. Another 15% have started their first dose. It was highlighted in the chart. That brings our 5 to 11 vaccination rate up to about 55%, the national leader. We also have high vaccination rates among 12 to 17-year-olds. About 81% have at least 1 dose. And some of the logistics behind contact tracing and test to stay. We have been expanding the use of antigen testing in schools under test to stay. At some point after the holidays, we will be evolving the use of antigen testing in schools to further so that we can make those tests more broadly available to both students and their families. This will be part of a larger testing strategy to expand the access to antigen tests across the state. Under our extended school program, when students need access to antigen tests, schools will be able to provide to families and their students, and the parents, not the schools, will be responsible for administering this at home. That's a major thing we're going to see. Essentially, schools will become a distribution point of antigen tests for students and their families, not administrators of a testing program. This will result in a loss of some of the data that we've come used to from our testing, so we are evaluating to what extent we'll be able to maintain the weekly reporting of cases in school. We saw that these data lose some of their currency with the Delta variant, and we expect Omicron will further challenge the timeliness of these data. We will continue with our PCR testing in schools, but we'll be making a shift from PCR to LAMP testing. LAMPs are confirmable tests like PCR, but they provide results much more quickly. They're administered on-site in schools, and the results of the tests don't have to be shipped to the lab. The expansion of tests I just described won't begin right after the holiday, but shortly thereafter. Similarly, we'll be bringing the expanded LAMP testing line later in the month. Expanded testing will be one of our important strategies with Omicron. Secretary Smith will provide more information on our testing program in his remarks today. In terms of our mitigation recommendations for schools, we're still evaluating if changes to our recommendations will be necessary. We will be pushing back the implementation of our recommendation for not requiring masks in a school when the student vaccination rate is greater than 80%. That recommendation was scheduled to go live on January 18th. At this point, it's likely we'll push that date back till after the winter vacations, which is February 28th. Remote learning, like we saw last year, is not a policy under active consideration at this point. I expect we will see some intermittent school closures in the coming weeks as a result of staff availability issues, since schools do not have many substitutes to draw upon. However, the recent changes in the CDC guidance on reducing the number of days required for quarantine isolation will help with both student attendance and staff availability. If the school does need to close due to staffing shortages, we'll address school attendance requirements through the existing waiver process. And I will be publishing an expedited waiver process for schools to follow later in January. That concludes my update. I'll now turn it over to Secretary.
Afternoon is a long one. It's not going to be that long. As of today, over 79% of Vermonters age 5 and up have received their full primary dose of COVID vaccine. Around 233,000 Vermonters have gotten a booster shot. That's 53% of the state's population. That's 18 years and older. For those 16 years and older, getting your booster provides the best protection against getting a severe case of COVID. It also ensures we have the capacity we need in our healthcare system. For children ages 5 to 11, the best protection is to have 2 doses of the vaccine. We're making good progress on that front. As of today, 23,757 have received their first dose or have an appointment to get their shot. That's roughly 53% of all Vermont children ages 5 to 11. 42% are now fully vaccinated and up to date. As I mentioned last week, holiday season, we're asking for to take some common sense steps to help us keep the number of COVID cases in check. These steps are the following. Number 1, get vaccinated and boosted. Number 2, test. Before you gather with other households, plan ahead to get tested first. I'll come back to that topic in just a moment. Number 3 is to mask. When you gather, please wear a mask as much as possible when you're inside. And finally, number 4 is to ask. You should know the vaccine status with whom you're gathering. That includes knowing whether they're up to date and received their booster shot. Going back to testing for a moment, just prior to Christmas and right after Christmas, Vermonters did their part. They turned out either to get tested or to pick up rapid at-home tests. Significant testing opportunities continue to be available statewide through our regular testing program, which includes PCR tests. Just yesterday, the health department either added more appointments to or increased the hours at existing testing sites. These include clinics in Berlin, Waterbury, Northfield, Williamstown, Burlington, and Middle. They also added new pop-up clinics in Addison, Washington, Bennington, Chittenden, Franklin, and Rutland counties. In addition, for the holiday season, this has been distributing rapid at-home antigen and LAMP tests. This is done either by appointment or at walk-in and drive-through sites. Last week, on Thursday and Friday, more than 50,000 rapid take-home tests were distributed for free across the state. That's 25,000 kits, 50,000 tests, 2 tests per kit. This was done through existing testing sites and 8 pop-up locations run by VTrans. I want to thank VTrans staff for their help in distributing tests. This week, we will distribute at least as many rapid take-home tests as we did last week. Distribution takes place today, tomorrow, and Thursday in the lead-up to the New Year's Eve holiday. It is important to note these rapid take-home tests are an additional layer of testing offered during the holiday season. We're pleased to see Vermonters using this tool. Demand high, and many sites ran out of the rapid take-home test within hours last Thursday, and probably will today and tomorrow as well. We'll continue to purchase more rapid tests for broad distribution, but like other states, we are constrained by the reality of the current supply of tests nationally. As more take-home tests become available, we will get as many as possible into the hands of Vermonters as fast as possible. As a reminder, we have a world-class testing structure which also includes PCR tests. PCR testing is available widely across the state this week, and going forward, PCR testing is a key tool to detecting COVID. The regular schedule of testing clinics resumes after the holiday. We encourage Vermonters to continue to use our world-class testing. Now, I want to turn to testing for students. Vermont is committed to keeping student schools as much as possible. As the governor mentioned, in the lead-up to the return to school after the holiday break, the state is going to be providing rapid take-home antigen tests to families with children in kindergarten through 12th grades. These tests are going to be distributed across the state and available for any K through 12 students. I want to be clear, these tests are not intended as a requirement for students returning to school, but they do offer families the opportunity to test their children before they return to the classroom following the winter break. And we're urging families to take advantage of these tests. More information about these tests for students will be provided later this week. Now turning to hospitals. So far, we're encouraged to see capacity in our hospitals remain steady, as Commissioner Pichek out. Obviously, this may change as we see how many cases show up following the holiday gathering. But I do want to thank healthcare workers, hospital staff, as well as FEMA and EMS teams for all their work to ensure that our hospitals continue to have beds available for Vermonters. As all the data shows, the best thing you can do to ensure hospitalizations are kept under control is to get vaccinated and get boosted. So whether you're looking to get vaccinated or to get tested, visit Vermont.gov. You can also call 855-722-7878. In closing, as the governor mentioned, this is my last press conference. I will be retiring at the end of the week. But before I go, I want to deliver a few thank yous. First, to all, particularly in my agency, but also to all employees across the state, especially our healthcare workers and responders. A big thank you. I know how much you've sacrificed during this pandemic. The weekends, nights, and holidays you have worked to keep Vermonters safe. You've built a world-class infrastructure to respond to this pandemic. We test more than most any parts of the country. We are one of the most vaccinated states in this country, and we have continuously protected our healthcare system and prevented death with the lowest per capita COVID death rate in the country. I am so proud of how our workforce responded during the pandemic. Next, I want to thank the governor for his leadership, his insight, his attention to detail, and his level-headedness during the response. Without his leadership, it would have been impossible to build the world-class infrastructure that I just mentioned. For those who don't know, we are successful because the governor dug deep into every plan brought forward, asked the pertinent questions, the right questions, sometimes ones that no one else had thought of. And because of all of this, he made the team function better in our planning and institution. Governor, I thank you for your leadership. Lastly, to the people of Vermont, I have never been prouder to be a Vermonter. You stuck together throughout the pandemic, and you continue to do so today as you look out for your neighbors, your friends, and your loved ones. You have proved again that this state could show the rest of the country, heck, the world, how to best respond to a once-in-a-century event. Because of all these elements of success, the dedicated employees, the leadership of the governor, and the ways in which the people of the state have come together, one person leaving is not going to change the course of our response. My only hope is that along the way, I helped make a difference while I was here. So I thank all of you. It's been an honor to serve. I'll now turn it over to Dr. Levine for a health update.
Thank you, Secretary, and it has been an honor to serve with you. I would like to pick up on Secretary Smith's approach of covering lots of material. I have a number of items, and I want to also pick up on the thanks to Vermonters and join everyone up here in hopes that you all had some time to enjoy the holidays in a safe way. As we flip the calendar to the second winter of COVID, I want to again acknowledge thankfulness for the positive response to our guidance for protecting yourselves and others. It's always stressful and never easy to plan holidays, but so many of you stepped up to actions that would to keep your families, friends, and loved ones as safe as possible. Taking the time to get tested, including sometimes waiting in long lines, is a tribute to Vermonters' can-do attitude. We deal with challenges as they come, and again, you rose to it. You clearly heard my message about protecting the most vulnerable person in your life, and I thank you for that. As Secretary Smith said, there were thousands of test kits distributed, and more will be available in the lead up to New Year's. As we have experienced, the pandemic is an ever-evolving challenge, the latest of Omicron. It's only the most recent that the SARS-CoV virus threat us all. Testing is so more each day about this new variant, but one thing is certain. It is here, and it's the most contagious version of the virus yet. While it's already becoming the most dominant variant around now, it will soon become dominant in Vermont. We already know the basics for slowing its spread and protecting each other. One is to know if you have it and to take the appropriate steps to keep from giving it to others. So yesterday, as most of you have probably heard by now, the CDC announced new guidance for isolation and quarantine to help us deal with Omicron. Interestingly, it may make life easier for us all because of how transmissible the virus is now. Now remember, when we use the term isolation, that is the period following your positive test or active infection. The word quarantine follows your exposure to an infected person when you're a close contact, but for the moment are free of infection. The science has found that even more so than the strains of this virus, most transmission of the Omicron variant occurs earlier on in exposure, generally within 1 to 2 days before onset of symptoms and 2 to 3 days after. So the CDC has shortened the recommended time for isolation, basically cutting it in half, from 10 days for those who are positive to 5 days. If asymptomatic, followed by 5 days of wearing a mask when around others. In addition, CDC revised its recommended quarantine period for people who are unvaccinated or those who are due for a booster but have not yet gotten it. With a booster or recently vaccinated, meaning less than 6 months since the mRNA vaccine or 2 months since J&J, still do not need to quarantine, though a test is recommended 5 days later. So the essentials of their plan are, of course, the change in the number of days, but also of our masking in the post-isolation, post-quarantine period, no reliance on testing through any part of that process. Vermont is adopting these recommendations effective immediately. Because CDC only announced the guidance yesterday, we are reviewing the details for their impact on Vermont, such as in Congress meetings. We'll be making this information and more available to the public and healthcare providers as soon as possible. Please know that it will take a little time for all the related materials and resources to be updated. And one more important point. If you test positive with an at-home test and you are not severely ill, please do not go to the nearest emergency department. There is no need to get a confirmatory positive PCR test unless you qualify for one of the treatments that I will speak about in a few minutes, in which case you should be talking with your doctor. This brings us back to the holidays. Many of you have been enjoying the season with friends and breaks, resulting from being around more people than usual. We'll also be seeing an increase in cases as a result of Omicron. This is not welcome, but likely inevitable. However, as the case numbers increase, I suggest we not focus too much on those figures. Many of you may regard case number data as important, and I understand that, but really what I and every person on this stage will be watching closely are the data and metrics outcomes among people, specifically hospitalizations and deaths, just like we've been doing every day since day one. Here's why. Even if you get sick from COVID, if you are fully protected, meaning you've had your primary vaccine series and your booster shot, you will generally have mild cold-like symptoms, or at worst, flu symptoms, and the illness may be short-lived. Like having the flu, it's not fun, not that being sick ever is, but full protection means you should escape the worst of it. And reports from around the country and in Vermont are bearing this out. The data on serious outcomes, however, are key indicators of the worst impacts of the coronavirus. These are the figures that inform us of where we are in the pandemic, and as they each of us can get any needed care, whether we have COVID or another health need. Let me emphasize once again, you are not fully protected against COVID-19 or up to date on vaccination until you get that booster shot. You are also not fully protecting others until you get booster shot. Now, among those at high risk and otherwise vulnerable to the greatest dangers posed by the virus are our youngest Vermonters. You've noticed that around the U.S., pediatric hospitalizations are up in a somewhat alarming way. We are fortunate so far that we are not seeing that here and don't want to. Now, our vaccination rate in the 5 to 11-year-olds leads the country by a long shot. And by mid-January, over 55% of this population will be protected. Unfortunately, that is not good enough. So I'm again asking every parent and caregiver in Vermont to please get your children vaccinated, ages 5 to 11. The time for thinking about it has passed. There is vaccine that is just for kids so they can have the protection they need to stay healthy and safe. It's for them and the people they are with, their grandparents, so they can stay in school and enjoy the childhood they deserve. You can find more information on our website at healthvermont.gov/kidsvaccine. I do have another topic or two to cover, and appreciate your staying with me. Let's turn to monoclonal antibodies. These have been our mainstay thus far. They are the treatments that can be used for those age 65 or older, or those with certain medical conditions. The same long list that I've recited here many times, and that you can now find on our website, healthvermont.gov/COVID-19-testing. If this is you, and you test positive for COVID-19, reach out to your healthcare provider as soon as you can get your result. Timing is important to successful treatment. One of the advantages of how the pandemic has gone on is that it allowed time for new treatments to be developed. Vermont has received an extremely limited supply of all the current COVID-19 therapeutics. Sotrovimab, Evusheld, Paxlovid, and Molnupiravir. They've either arrived or will be coming in several days. The federal government will continue to allocate supply based upon hospitalization and case data, and this will continue through most of January. Sotrovimab is the only monoclonal antibody now with activity or efficacy against the Omicron variant. Like all the other monoclonals, it requires an infusion center, and this one is only delivered intravenously. It's also effective against the Delta variant. We still have a limited amount of the older monoclonal antibodies as well, and where the chance for Delta infection is high, and until Omicron is responsible for over 80% of infections in Vermont, which could occur within a week, is appropriate. Today, the CDC's modeling on their Nowcast section of their website revised last week's report and actually downgraded the amount of Omicron around the country and in our region. Around the country, it's currently in the 56+% range and varies greatly by different regions. One is we are in New England. Last week was downgraded to 11%, even though we thought about 3 times that. It's now in the 44% range. So there's still plenty of opportunity for us to use these older monoclonal antibodies because many of our new test positive cases will still be Delta. Evusheld. Evusheld is the only new medication that serves as a preventive. As I mentioned last week, it's a long-acting injectable monoclonal antibody. It's for people who are immunocompromised and have an inadequate response to vaccination. It's used for people who have not yet been exposed or infected with virus, and it may provide over 7% reduction risk of developing symptomatic COVID-19. This one is given by an intramuscular injection. Now, all these other medications are intended for people who by age or underlying medical condition are at high risk for a serious outcome from a COVID infection. The decisions regarding the 3 drugs, Sotrovimab, Paxlovid, and Molnupiravir, are guided by effectiveness against severe outcomes, potential adverse effects, or contraindications. Now, if you have a positive COVID test and do not require hospitalization, Paxlovid, which we anticipate coming in as preferred due to the fact that it's an oral medication and has an extraordinarily high 85% efficacy rate against serious outcomes, so long as the ordering doctor or other clinician does not identify any serious considerations regarding interactions with medications the patient be on. It can be given to people age 12 and above. If there are contraindications or the drug is unavailable, and if intravenous therapy is an option, the monoclonal monoclonal antibodies, Ovimab, would be the preferred drug. That is also for ages 12 and above. The third and final choice would be molnupiravir, which is also convenient because it's oral and will be somewhat more available because Merck had a lot of time to gear up its production before its approval. It, however, suffers from having the lowest efficacy rate, but keep in mind 30% is better than 0, and it is unsafe in pregnancy. There are also theoretical concerns it will increase the mutagenicity of the virus. This drug is only for people age 18 and older. So if I could sum up everything I've just covered, it would be this. We're nearing the point, but not quite there yet, where COVID is an endemic virus. One that we'll contend with each year, like the flu, getting vaccinated regularly, managing our health needs and risk tolerance. We're nearing that point, but we have a ways to go yet. We have Omicron, which moves fast within days, and from other parts of the world may actually race through the population. It remains to be seen if that will be true here in the United States. So we all must stay on our guard. We absolutely need to do everything we can to prevent the spread of this virus, which has taken the lives of friends, family, neighbors, and millions of people around, and changed the lives of millions. No one of us wants to be the person responsible for making someone else sick or worse, especially if there's something we could have done to prevent. The theme is that we're all in this together. Our state is working hard and with partners across Vermont to make tests and other resources available to you where you are. So let's do all that we can as individuals. Wearing masks. And wear masks that are doubled up, either cloth and surgical, or just an N95. Test regularly, maintain distance, stay sick, and use the same rules for New Year's Eve gatherings that you used for other holidays. Have the COVID talk so you know the vaccination and booster status of all your guests or companions. Keep the groups very small this time. Have a testing strategy with either additional PCR or rapid LAMP or antigens. We've come this far, and I know we can do this. Thank you, and here's to a better and healthy 2022 for us all.
Thank you, Dr. Levine. We'll now open it up to questions.
Starting with folks in the room.
Governor, the thing that most perked my ears up about Secretary French's presentation was this warning that schools could possibly close due to staffing challenges. That would be quite impactful to many families. What then would be your advice to moms and dads who might worry about child care or their own workplace obligations?
Well, first of all, get boosted. Everyone get boosted, whether the staff, teachers, parents, to be focused on getting boosted to prevent this from happening. I think the French talking about is real. We know that it transmits very quickly, and we know that we have limitations in terms of work across all sectors. So we're watching this not just in the education community, but throughout every sector across the state. So we want to protect ourselves as best we can in light of that. But again, I think Secretary French was forecasting, preparing to in case this does happen. But we all have the ability to do what we can to prevent that from happening, and I still believe there's an opportunity to do so. But again, cases are going to rise. We know that. But the metric we're watching is hospitalizations, and then again, prevent from having booster.
How can the rapid antigen testing. You mentioned that the state looking into sending antigen tests to households. It is all similar initiative with about 3 million tests or so. Why are they able to carve that out right now when we are still
Hard to know. I mean, obviously antigen tests are in short supply and increasing demand across many states. Some states have been more successful than others in obtaining them. We're working with the federal government right now. We hope to be able to announce a plan where we might have more at our disposal, but just not ready to talk about that until it actually happens. I just don't want to mislead anyone until we know for sure. But we hope to have a similar plan that we'll be able to communicate.
I was looking at the website. It looked like there were a few of the antigen giveaways, I guess, that were canceled, and then there were brand new testing sites that were set up. Those are looks like they're booked out in some population centers. If people want to find a state-run test before New Year, are you going to happen?
Well, at this point, we are going to be getting antigen tests out to the 80+ thousand students across the state. We think that's a positive step, but again, we're distributing them the best we can with the supply we have without impacting all other sectors. Our responsibility, again, our focus has been on the plan, the test to stay in schools, as well as long-term care facilities. So we want to make sure that we reserve enough testing, antigen tests for that, but distributing the excess as well. I mean, again, in the last week and this week, we were able to get tens of thousands of tests out, but again, we have 600,000 people. We know that wasn't going to be enough, and again, there's a lot of demand for that. Anything you want to add to that, Secretary Smith?
Kevin, we did add testing sites, pop-up sites to the website. We added for tomorrow a Chittenden County pop-up site in Williston with 200 appointments, and we also added new pop-up clinics in Addison, Bennington, Franklin, and Rutland County. Addison County, 150 appointments. Bennington County, 150 appointments. Wednesday, Addison County, another 150. Franklin County, another 150 appointments. This is above and beyond what we do with testing in those areas with the state testing sites. Rutland County, also another 150, and we've increased the hours in Washington County as well. Berlin hours have been increased today from 9 to 6. Berlin on Wednesday will be 9 to 7. Waterbury on Wednesday will be 9 to 7. Remember, if you want to get tested, you can still get a PCR test and still have the results before you go on the holiday. So I would encourage everybody to use all the platforms that we have, the antigen tests, the PCR test platforms that we have. We have numerous sites where people can go and get tested.
And we do have, Secretary Smith, we do have the LAMP tests on.
Those are by reserve, by reservation.
But that's on the
on the website.
30th or 31st?
Yeah, on the 30th.
30th. Okay. And also, pharmacies are being restocked. They're limited in numbers, but people should check there as well. You have to pay for them, or unless you have commercial insurance, which will be reimbursed.
This is a question for Dr. Levine. This change by the CDC, more than a few people have noticed that CEOs of airlines, this is a change that they were at.
We were looking at this as a state over the last couple of weeks. We weren't ready to communicate that at this point in time. We wanted to see what the Omicron was going to do. Ours was a bit more conservative. We were looking at 7 days with a testing platform as well. We We still may have guidance in that regard that may be a little bit different than the CDC, but we haven't gotten together as a team to discuss that. But we may come up with our own version of the CDC guidance that we think might be more appropriate for Vermont. We want to keep it simple. We want to be able to use it across different
results, especially in tests, like in greater numbers.
Yeah, you're absolutely right. It will affect our numbers. While we might hope that people who test positive with an antigen test would call in, the reality is probably not. So it's going to affect a number of different things. The rate will increase. It probably will increase. But as well, we need to just go back again, and having the data is important. Trick that we've been using since day one is hospitalizations. Using that as an indicator is what we have that's consistent beginning and throughout this pandemic. And remember, the antigen test, PCR test will continue with them. That's part of one of the toolbox, and we want to continue to utilize that. But antigen tests are going to be just another tool that we can apply and will give us instantaneous. And so the contain the virus. That's what we're hoping will happen. So while it's in of us, for all of you, to get the data, it's more important that we get the test results individually, that we don't. So again, while it's unfortunate that we're going to be missing some of this data, the important part is that we're going to be able to stop the virus from spreading, and that's our goal. Dr. Levine?
And we've made it really easy to report your result. The minute you click on the COVID portion of the Department of Health webpage, you'll see you can click on a special button and you'll get to the little form, which only has a few questions, and you can put your data in, which, as the governor said, is somebody could make a decision because they had a rapid test and they knew the result. And unfortunately, I've heard from many people that even though they regretted it, official, because they learned before their Christmas gathering that somebody was positive, and it changed the whole planning for the holiday. But they could make that adjustment instantaneously in their lives, and even though we may not know that they actually had a positive test, the right outcome occurred and they protected others around them. So that's really the ultimate goal in all of this. Keep in mind, every one of us grew up knowing what the flu was. And every year we think about the flu because there's always a flu season. None of us knows how many cases of flu in any season there have been, except for last year when there were almost none. So we knew there were almost none. That was so remarkable. But we've never relied on knowing how many cases of the flu there are every year to try to figure out what we should do or not do with regard to the flu. But we have relied on how many people are in the hospital because of the flu and how many people are actually dying from the flu as a way of really understanding what we need to do with influenza from a year-to-year standpoint. So though we're not endemic yet with the COVID-19 virus, SARS-CoV-2, that's where we're headed. And that's why case numbers are not going to be as critical for any of us to know. I really love percent positivity because Vermont has throughout the pandemic enjoyed one of the lowest ones you can have. But we're going to have a distorted view of percent positivity if we don't know the whole universe of data. So concepts like are just going to vanish eventually.
Thank you very much. And Governor Scott, just a quick question for you. Right now, the Joint Rules Committee is discussing reopening plans for the upcoming legislative session. Just wondering, will you be there in person, and do you think it's appropriate for everyone to be there in
Obviously, we'll work with the legislature to make sure that we adhere to their rules. It hasn't been determined whether I'll be there in person to deliver the state of the state. That's something we'll have to determine over the next few days. In terms of whether they should be or shouldn't be, this is a decision they need to make in the best interests of their members. And again, we'll adhere to that policy. It's really my hope that this is short-lived. If they do go remote, that we can get back to in-person like Congress has done and other states have done as well. Because I really think we're missing something, and it's been done for all the right reasons. I'm not criticizing at all the decisions they've made on this, but I do know that we'll get a better product. We have a lot of work to do, and being in person, face to face, is something that is essential to the process. So we'll see what they do, and I hope this doesn't continue throughout the entire legislative session, that at some point in time, we'll be able to get back to in-person legislators coming to the State House, and the people coming as well to debate the issues.
Great. Thank you so much. That's all for me.
Chris Roy, Newport Daily Express. Chris Roy. All right, we'll move to Aaron Patanko, VT Digger.
Hi, I have a couple questions. I believe that they will be for Secretary French. The first one is just to clarify, when you say that you're planning to have schools distribute those antigen tests, are you talking about distributing them just for this week, or are you also talking about having schools distribute them for the Test to Stay program?
Yeah, first of all, I want to clarify, we had said we're going to distribute those tests. It's not going to be the schools that distribute the antigen tests this week. So we just want about that. We'll be able to give you further or so on that. We don't want to impact the schools themselves. We know they're under a lot of stress as it is. But this is what we're doing right now. We do have a reserve benefited from that. Secretary Smith, or, sorry, Secretary.
Where we're going with Test to Stay is I'll call it an evolution of a practice and a strategy in response to Omicron. We've been making steady progress on the expansion of Test to Stay and use of antigens. Prior to the holiday, we had added public pre-K into that. The broader availability of antigen tests as being a key strategy. I think, as you've heard some of the questions today, the rub is going to be the process, and it's going to be hard to have it both ways, meaning that we've largely to the public health apparatus and so forth. As we seek to expand the amount of testing going on in our communities, we're going to have to let go of that control. So it's not going to happen immediately after the holiday, but I would hope by mid-January we're going to start to make a shift where schools are acting more like distribution centers of the testing. So when students are identified through the contact tracing process and so forth, that schools would provide an easy means of distribution of the test for both students and families. But that's ultimately the goal, is to put more of the testing out in communities. Again, that's going to be a key strategy to containing the Omicron variant.
Okay. In the past, you've mentioned concerns about parents being honest about their kids having an exposure, testing positive. Do you have concerns about that with these tests being given out? Especially parents are going to be struggling to find childcare or regular shortages across states.
Yeah, so much my personal concern I've highlighted throughout the pandemic. If you can remember, in the early parts of the pandemic, where schools enacted symptom checking, which was recommendations. This was pre-vaccination and to a certain extent pre-testing. we had that sort of initial pushback from schools to a certain extent that they were uncomfortable with allowing parents to do symptom checking. Ultimately, we did allow parents to do that, and I think we're going to have a similar transition. And again, it's going to be a balancing act between deploying more testing versus controlling that process. And again, I think Dr. Levine's sort of story around the holiday, if we can put the tests in the hands of people to give them action information more quickly, ultimately that's what's going to lead to containment of the virus. That's ultimately, I think, how we're going to utilize schools. And I will say personally, I've been anxious to shift our focus at the state level because we do have considerable federal resources to work more directly on what we call the education recovery issues resulting in the pandemic. So I would like to make that transition so we can more appropriately, I think, focus on the educational work that's in front of us relative to the impact of the pandemic on students.
I believe it was you who said that in February to extend their school year if they switch to remote learning. Has there been any changes to that? I know, I think the last time we discussed this was like in September, October. So I don't know if there have been any updates on that front.
I'm trying to remember the specific comment. I don't know to what extent I said that, but I did mention what you're referring to. We have an existing waiver process in our regulation that basically kicks in around February. And that's a process that the state board has given me authority to adjudicate again. That's what they've done for the last couple of years. As I mentioned earlier in my remarks today, we'll be publishing an expedited waiver process for schools to pursue. But that'll be our primary approach to dealing with any kind of school closure as a result of staff availability, basically to leverage the existing waiver process that we have in regulation.
Okay, thank you.
Joseph Gresser, Barton Chronicle.
Hello. I have a question which I believe will properly go to Dr. Levine. There was a recent report, and it's not a scientific paper, and I know this is an early stage in the research, but it was about some work being done at Walter Reed Hospital on a vaccine that uses multiple parts of coronavirus as its target. And the report suggested that it's been successful in the early part of trials and its design could make it effective against all forms of SARS, which I think might include the common cold, but next time. I wonder if you've heard anything about it and where it is in the testing, and if any.
Yeah, I'm not gonna be able to enlighten you much more beyond what you've said, because you're right. It's not really a scientific report that's come out yet. What I can tell you, though, is learning from Omicron, our latest variant, that has over 30 mutations in the spike protein area, which had people first. It also had an additional 20-ish in other parts. And the theory here is that the next variant, the one after that or whatever, may continue to evolve in that same direction, and soon the neutralization antibody capacity against the spike proteins may not be effective in the future variations on the theme. Unclear if that will become true, but more so than just the common cold, I think what they were intrigued by at Walter Reed was also some of the older and more lethal SARS viruses, like the SARS, the first one, the SARS and the MERS, which was that in the past caused a lot of worldwide concern initially and then fizzled out, fortunately. So the thesis here is that you'll have a more generalizable vaccine that could span coronaviruses than just the one we're preoccupied with right now. But I really don't have any more insight to give you in terms of how those trials are going and if that will be reality.
Thank you. One other question, is the theory applicable, for example, to the flu virus?
Yes, so there's a lot of talk about a universal flu virus. So these are the kinds of studies that are ongoing right now because each year the flu vaccine is made based on a previous year's experience, trying to guess what the flu is going to throw at us the next year and trying to design the vaccine in a way that will cover those variations on the theme. So a more universal vaccine would be a welcomed event. We're not that close to that, but we're closer than we've ever been. So just stay tuned.
Thank you.
Greg Lamoureux, the county courier.
Good afternoon, Governor. First, I want to start with Secretary Smith and reiterate my thank you for the work he's doing in the state of Vermont. Since this is probably the last time you talk, what's the status of the internal investigation you called for with the George Elementary School teacher charged with sexual assault? And as you know, multiple DCF reports were made years before that.
Greg, I don't have an update on that right now, but I'll make sure that we do get an update to you right after I get done with the press conference here.
Thank you. Levine here. Dr. Levine, I've heard some people say that, there may be a silver lining with the Omicron variant. Although it spreads easier, it also is reported to have a lesser impact on infected people. Some have said that this is maybe a good thing, that we're going to get to herd immunity with those who refuse to get vaccinated with a variant that they may be infected slightly less with. Combine that with the new treatment of Paxlovid, we might actually be seeing a good scenario with COVID. I'm wondering what your thoughts are on that. And you mentioned Paxlovid would be available in the state hopefully by the end of the week. I'm wondering to what extent it would be available, or you expect it to be available.
Sure. All good thoughts and good questions. The reality is that there will be a great degree of what is termed natural immunity, meaning the kind of immunity you get from getting the infection, and vaccine-induced immunity from the vaccine. There'll be a greater degree of all of that together once Omicron has come through and being so infectious, infected more people than probably any other variant has done. So some people do look at that as a little bit of a good sign, and the reality is that maybe we will have more of some kind of community immunity as of that. You have to still say is that there'll be people who are very vulnerable who may be impacted by this more infectious virus and don't do as well. Even in the era where more treatments are becoming apparent. And keep in mind, we're in a little bit of a race because there isn't much access to the treatment. They've been approved very recently, and timing of Omicron. So unfortunately, that disconnectedness occurs. Paxlovid, though, should be, many of us are hoping it will be somewhat of a game changer because it is an oral drug, and unless you take other medications for which there may be a interaction and hence a contraindication to taking Paxlovid, there may be many people who qualify for the drug. It's pretty user-friendly. It does have side effects, so we'll have informed consent and be a side effect. The reality is we'll have the ability to treat somewhere in the range of a couple hundred people at most early on in our experience, and that's all related to federal allocation, trying to be fair across the whole country. So it's not going to be a lot of people that will have access to the drug. Early on, we hope that production ramps up and that as we get into the middle of January, those numbers can increase significantly.
Clarification here, a couple hundred people a day, a week, a month?
A week.
A week, okay. And that's going to be based on like age, maybe going to be based on like their underlying.
So there'll be some geographic equity across the state. It'll be distributed probably via drive-through pharmacies so that infected people don't have to be confronting the public and pharmacists, et cetera. And it will still determined by their age and or underlying conditions that would qualify them to take that drug.
Okay. Thank you, Dr. Levine.
Russell Forbes.
Hi, thank you for the question.
We can.
Okay. The governor just pointed out that it's important to be able to get your test result shortly after you've been tested. And I'm wondering if the state collects any hard data on the number of days that it takes to get a result after you've done a PCR test. Here in Rutland, where I happen to be today, it can take more than a week to get a test result. And I'm wondering, is that normal? Is it possible?
Special occasions, we use our public health laboratory, which likewise has a very short turnaround time. There are laboratory corporations that can take longer. So depending on where you got your test, could be at a pharmacy, could be at a urgent care or somewhere else, you might have a longer wait based on those laboratories' performance. So it's not really Rutland's performance versus Burlington's performance, it's the laboratory that's used to run the test. So if you could send us any knowledge you have of the test that you got, we could get some better understanding. We do keep track of this data, though I don't believe we have this on our website. But we keep track of this data called turnaround time because it's critical to us. You can't manage a pandemic if your data is 5 days old.
Thank you. I had one other question, which is about the economic impact of the continuing pandemic on the tourism industry so far here in Vermont. Is there someone that could speak to that?
Sure. I think Secretary Curley might be on, but I will say, we've been performing quite well in some respects over the fall going into winter in terms of receipts. We've been watching that, and it appears that we're going to have a successful winter season, but Secretary Curley might be able to answer that.
Hi, Governor. Can you hear me?
We can.
Okay. So when asked about the tax, I'm assuming we may not be just talking explicitly about the tax, but more about how the industry is doing as a whole. So I'll attempt to answer, just support what you just said. I can't give you the exact figures, but we are seeing a really nice rebound for the hospitality and the tourism industry in our state. Vermont is seen as a safe place to be with lots of outdoor recreation opportunities. So we've definitely seen a nice rebound there, and I do believe our rooms and meals taxes are up at this point. We know that there continues to be challenges with workforce having enough workers to fill the vacant job. But businesses are really, they've pivoted and they've changed their models a little bit and tried to make it work, but still really, really searching for more help because they would like to take on more and grow more. So overall, I think we're feeling very fortunate about where we're headed and hope that we can continue and that we can create the workforce and the pipeline to fill those vacancies.
Thank you again.
Thank you.
You bet.
Lisa Loomis, the Valley Reporter.
Good afternoon. What were the self-report rates for the December 23rd LAMP and antibody test? I don't mean the positivity rate, but the rate of people reporting the results.
I can't, Lisa, I can't give you a rate. I know that since we've been having the self-report mechanism, we're in the 1,200 to 1,500 person range. And I believe from the Christmas holiday, that was about 900 of those. But that doesn't give you a rate, because to calculate a rate, you'd have to know how many people did antigen tests, both the ones we handed out and the ones they bought at pharmacies, et cetera. And we just have no insight into that part. But we have the absolute number, which is what I've given you.
Great, thank you. And I'm not sure if this question is for you, Dr. Levine, or for the governor, or for Secretary French. Will schools be following the new CDC guidelines for isolation and quarantine? Parents who've been listening today are confused by what you said about adopting these guidelines immediately and what Governor Scott said about the state potentially creating its own guidelines. I've been watching and listening, and I'm confused too.
Yeah, I'll let Secretary French answer that.
Hi, Lisa. As Dr. Levine said, and the governor as well, this just happened, so we're in the process as a team sort of debriefing on that. I think, we think it is good news. As the governor mentioned, we'd already been working in that direction anyway. But whatever we do from schools will be exactly what the health department prescribes for the state and so forth.
Great, thank you very much. Thanks, everybody.
Howard, VPR.
Okay, thank you, Jason. So we've been talking a lot about the home tests and about people reporting and not reporting and what that means for the state's numbers. But can you be a little more specific, if possible, on what the future may hold as far as the quote-unquote official numbers that come out? A lot of people, look at the data every day. They make decisions about it, where it is in the state. Is there going to come a time when you're just not going to report it? And even at this point right now, with the few home tests happening and that increasing, how reliant can we be on the data that we do have?
Yeah, we're in a transitionary period, and I can't stand here and tell you that we're going to be able to continue to give you the data that we've been being able to communicate to you over the last almost 2 years, because it's just a different approach, different strategy. This antigen test will be, I think, instrumental in containing the virus, but we won't have the data available. We'll continue to provide any data we have and be able to give you that information, but it's, again, difficult because we want people to use antigen tests. We'd like them to report it back to us if there's a positive case or a negative test or case, and so that we can really determine what's going on. But the bottom line is we want to contain the virus, and we want people to be safe, and we want people to get boosted, and we want people to adhere to all the other policies. So while it's beneficial to have the data, the goal really is for people to assess their own situation and whether they're in a situation where they have tested positive or negative, and then make determination as to whether they proceed with whatever plans they have. Dr. Levine?
And it all has to do with the transition from pandemic to endemic. And while we're pandemic, we want as much data as we can because we need to have a good handle on everything we can. But at the same time, we are going to be transitioning to endemic at some point, hopefully once we're done with Omicron. And it's going to be a very different ballgame at that point. And no one's going to really want to be following the numbers as strictly as we've been following them all along. But keep in mind, PCR testing hasn't gone away. We have thousands of Vermonters accessing our PCR test sites all the time and reporting out large numbers of results. That's going to continue. But there will be a time when the phenomenon of having these state testing sites is in the past. Because we don't do that with any other respiratory virus that hopefully, this one included, occurs in a seasonal nature. People who are ill enough go tested through the healthcare system because they might qualify for certain treatments. Others may do self-tests at home because they want to protect others around them. But it will be a very different framework at that point because we probably won't have all of this apparatus that we have now in terms of testing centers, et cetera.
But you don't know if it's going to be weeks or months before we see a big shift in the data that's released every day?
No, I'd say it's in evolution, and it's occurring now, but we still have pretty reliable data that we can compare now to before in, but there's going to be probably over these next weeks, with more and more antigen testing being done, less emphasis on what is the percent positivity because it won't be an accurate number anymore.
All right, thanks. And one more quick question for the governor. We got a press release, I think yesterday, that J-Peak was offering a free water park day if they got their booster shot. And I know that you've been a little, you weren't a big fan of incentivizing shots at first, though we gave out creamies and we did a couple other things. I just wonder what your thinking on that is, as we have been kind of stuck at 82% as far as the folks that are. And I asked the same question last week. What other strategies are there for trying to convince those Vermonters who don't really seem convinced that they need to get the shot?
Yeah, again, presenting the data every week, like as we do, should convince a few people, and maybe some personal anecdotes from family members might help. It sounds like a great strategy they're using. It's a marketing tool in some respects, and they're getting people to do what's best for them and all of Vermont. And that's to get boosters. So if an entity like J-Peak decides to offer that as an incentive, that's fine. That's not something that I'm opposed to at all, and it works for both of us. So if there are other entities and individual businesses that have a strategy, I think Waterbury had an approach where they gave away gift certificates to their local downtown, shop local, and get a $5 credit of some sort. That's a great strategy too. So I think we're at the stage where if you want to do it, a business decides to do it, that's great. But I'm opposed to doing it on a statewide level with taxpayer dollars at this point. I don't think there's a need, and I just don't think that would give us the best return either. I wanted to go back as well. You asked how long before this data would be not being able to be provided, but as I said, we'll continue to provide it as best we can with a PCR test and so forth. But a lot of this is going to be predicated on the supply. It sounds like a lot when we talk about the president's goal of having 500 million antigen tests available to Americans. But when you do the math, it doesn't really work out. I mean, we need to continue that supply chain over quite some time, because that would, if everyone took one, that would be less than 2 tests per person. We need to make sure that the Production Act is enforced, the Defense Production Act, and that we get more and more of these into the supply chain. Because it's going to be essential in the future. And we're going to see an evolution of these tests as well, I would predict. they're going to be easier to use and simplified and hopefully less expensive as time goes on.
Okay, great. Thank you all. I appreciate the time. Thanks.
Lisa, the Waterbury Roundabout.
Hi there. Thank you, Jason. Can you hear me?
We can.
So many questions. On this question about having people report their results from the take-home test, I'm not clear on whether when they're handing out the test, are they reminding people as they're distributing them to please get on the website and log in to log their results?
I'm not sure that's the case. Dr. Levine, any?
Only that the package inserts, I'll tell them.
Okay.
Either through the company or through the health department.
Okay, apparently in the inserts in the test kits, it does have something that says you should report these to the health department or someone. So there is some sort of messaging in the test kits from the companies.
Okay, so that's clearly something that we could be informing people of too. I'm wondering, maybe this is a Dr. Levine question, are we confident enough of the results of these home tests that if somebody tests positive at home, is there still a recommendation that they go and confirm this with the PCR test as well, or should they just take whatever steps they need to take going forward based on the result that's a positive from the home test?
They should accept the result of the home test and not confirm it with a PCR if it's a positive test. So if they have symptoms and they test positive, or if they have no symptoms and they test positive, in December of 2021 in Vermont, there's a lot of COVID around, so a positive test is a positive test. It doesn't need to be confirmed with a PCR test. However, if you have symptoms that you think are compatible with COVID and you have a negative home test, you may still want to get a confirmatory PCR because the PCR is more sensitive, so that you will learn if your home negative test is truly negative or if actually it was a false negative because it wasn't as sensitive as the PCR. So that's the only time I would do that.
That's really helpful. Thank you. And I've got a question for Secretary French on the idea behind the home test now being distributed eventually in the coming weeks through schools. I'm sure that's going to be welcomed by a lot of families. One of the things that I've heard people very frustrated about is that there's been sort of a benchmark where the tests have not been handed out to the children in school unless they were considered to have been contagious in school. Given the fact that this Omicron variant is moving so quickly and kids could be exposed, and the goal is to try to keep everybody from spreading it, is that still going to be a criteria, or if someone thinks that they've been exposed, will these tests be available regardless of whether you think you were exposed at school or whatever, in order to try to keep the spread down?
Yeah, thank you. It's our intention to make them widely available regardless of where the contagion originated. So sort of to your latter point, it's our intention to use schools ultimately as a distribution center for the tests in our communities for families and students.
That would be great, because I know that's been a real frustration for some families who feel like they need the test and they haven't been available, and that would have made a difference for them. So I'm sure that's going to be welcome news. Last question I might want to ask, I don't know if this is something that's been considered yet. I know when the legislature gets together soon, they're going to be discussing town meeting and what the guidance is going to be for towns making their decisions for whether to gather in person. I'm wondering if the health department and the state's going to have any recommendations coming together as to whether it's going to be safe to have town meetings in person, or if it's going to look more like last year's town meeting.
Again, I think the legislature will have an interest in this, as well as the Secretary of State, and we'll be getting together with them to give any advice we can. But it'll be the decision of the Secretary of State and others. So we'll see. We've been advocating, as we did last year, for more of the mail-in ballots as well. So we'll continue to advocate for that.
Okay, thank you very much, everyone.
Lisa, as well, I just wanted to remind you, I know I said this earlier, but when we talk about the antigen tests and having them more widely available and distributed to a wider group, it's all predicated on the supply. So just keep that in mind. We're doing the best we can with the supply we have, which is limited.
Of course, good point. Thank you.
Guy Page, Vermont Daily Chronicle.
Good afternoon, Governor. Commissioner Levine said of vaccination, the time for thinking about it is past. And some of my readers are thinking not so fast given some new developments. 49-year-old New York Times editor died December 18th of a heart attack a day after he got his booster. Locally, a healthy vaccinated 19-year-old son of a friend of mine is now experiencing heart palpitations, never had them before. And also, experts are saying that Omicron is both less dangerous and more likely to result in breakthrough. Now, so my question is, if these developments are true and relevant, how is it still ethical to incentivize Vermonters, to use a term you used a couple of weeks ago, to vaccinate by taking away their livelihood?
Again, I think the data backs up our argument, but I'll let Dr. Levine make that.
You Guy, I don't know about these two cases you've mentioned, and if they are related to the vaccine, it's tragic, though we'd certainly want to ascertain they were. But the reality is, we now deal in hundreds of millions of doses of vaccine when we look at adverse effects. And the data from millions, hundreds of millions of doses does not really support a policy that would say these are dangerous and shouldn't be used. If anything, it's the complete opposite, that they've been extraordinarily safe for newly developed vaccines and efficacious. I think your comment on Omicron was the fact that there will be more breakthrough cases, a term we don't like to use, but you're right. And the reality is, yes, this is a more infectious variant, and even people who've been vaccinated can more easily get Omicron. But again, that's not what the vaccine was designed to do, prevent a case of Omicron. The vaccine was designed to prevent a case of Omicron from ever getting so serious that someone would end up in the hospital or, God forbid, die from it. And the data is backing that up throughout the pandemic with every variant strain that we've had. So again, keep your eye on the right ball. The ball is vaccines are meant to prevent severe outcomes. So just like you can get a cold from getting Omicron, and most people who have been vaccinated who get ill get a cold or a mild flu-like illness, their lungs, which are the main place that this virus can do a lot of damage, are very protected. And they're not presenting to the same degree as others who are unvaccinated with shortness of breath, with need to have x-rays for pneumonia, with ICU admission. So I do believe the data still supports the vaccine very well.
Thank you.
Meg, the Bradford Journal Opinion.
Hi, good afternoon. I noticed early in the press conference that Governor Scott said something about a plan to send out rapid tests to households with children within the next week before schools reopen. Is there anything else you can tell us about that?
We're right in the middle of finalizing that, and it's because we just got the supply, so we didn't know it was going to be available. So we want to distribute that. We won't, our thought is we're just going to have to use distribution points in some locations and try to get them to parents so that they can test their kids before they go back on Monday. But we'll have more details in the next day or so.
Okay, thank you.
That's it. Okay. Thank you very much, and we will not see you next Tuesday. The State of the State is on Wednesday, as they typically do. We won't have a press briefing, but if anything comes up, we will distribute that information. And if any of the media has questions, obviously you know where we are at, so we'll answer them to the best of our ability. So thank you very much, and Happy New Year.